Okay, welcome back, everyone. Hope everyone had a good break. I am now going to introduce Dr. Vu with the USF Clinic in Tampa. He is going to talk about active and upcoming clinical trials in ALS. Dr. Vu, thank you for joining us today.
Good morning. Thank you for this opportunity to be here and to present to you our research effort at the University of South Florida. This is our team. And before I start, I would like to express my sincere appreciation of the many patients out there who are participating in our clinical trials. Without your time, effort, dedication, and sacrifice, we would not be able to advance our current knowledge of this horrific disease. We have several trials going on at USF, and this is actually an exciting time in clinical trials. We have a lot going on out there, and we're glad to be a part of this among other centers in Florida. The first studies that I'm going to talk about is this champion study, looking at this medication called ravulizumab. It is a complement inhibitor. So this complement cascade is your innate immune system, and it can be activated by an intrusion organism such as bacteria or any sort of antibodies production. So what happened is you would activate this cascade, and through a series of chemical reactions, you would form this complex called the membrane attack complex on the cell walls, and that caused the cells to break up and die, and that's how we fight bacteria. Unfortunately, some of your body components, like part of the neurons, can look just like a bacteria and can cause this cascade as well, and that leads to cell death. And if that progresses over time, you can have progressive loss of motor neurons and therefore weakness and other symptoms. There's some evidence out there to suggest that this complement cascade may be ongoing. So if you look at a control sample here and looking for something called the MAC complex, which is this complex right here, you don't see that in normal individuals, but you see these deposition in tissues of patient with ALS. So there's some evidence that whatever the underlying cause is, it caused this whole cascade to occur, leading to destruction of the motor neurons and therefore manifesting as disease. So the idea, if you can block that, you can slow ALS disease progression. The idea here to look at how people progress according to the functional rating scale from baseline to 50 weeks out. We also will look at how your breathing capacity and your muscle strength is changing over that time, and how long it takes for somebody to require a ventilator. The study is 50 weeks. There's a planned safety review in the middle somewhere where they can look at to see if there's any safety issues or if the medication actually is working up to that point. And by the way, this medication is now on the market to treat a whole bunch of other diseases. So there's a lot to know, a lot that we know about it. And so far, we have not had any major issues in terms of safety. For every clinical trials, we would have something called inclusion and exclusion criteria. For this study, you have to have ALS onset less than 3 years ago. Your breathing capacity must be greater than 65% of predictive value for your gender, weight, and weight. If you're on riluzole or edaravone, you must be on a stable dose. You can't just start it because that can complicate the picture. If you're already on mechanical ventilation like a trilogy or a ventilator, you cannot participate. And if you've been treated previously with a complement inhibitor, that will also exclude you, but that the chance of that happening is pretty low, unless you have myasthenia gravis or one of those other really rare disease. The second study that we're doing is this phase 1 study looking at this compound BIIB 100. It's the phase 1 study, so it's the first time that it's being used in human. And the idea here is that here's your neuron. You have the cell body, and inside you have the nucleus. The nucleus is where the DNA resides, and the DNA code for protein and RNAs and things like that. And for those products to be exported into the cytoplasm here, you would need to use an exporter protein called XPO1. Basically, it's like a bus that take these passengers across the bridge here to the outside. And studies so far have shown that some of these products may be toxic and implicated in ALS. In animal models and cell models, if you block this exporting function, you seem to modulate or decrease the inflammatory activities and show that these cells actually survive longer. So that's the idea behind trying this out. It's the phase 1 study, which means the primary concern here is safety and tolerability. And they also don't know how fast this medication go into your system or what level, what dose is appropriate. So that's why we have this stepwise study where we will start out really low dose, stop, look at the safety profile, and then gradually go up. So this study has been going on for the past year. So we're actually right at the beginning of cohort 5. So we're right here. So in the next month or so, we're gonna test this second dose, this fifth dose, 80 milligram, and it's just a 1 dose time. So the patient will be admitted, and we do all the preliminary safety measurements, and then give you 1 dose on the first day, and basically just draw your labs for the next 2 days and see how fast the drug gets in the system and how high the level is and so on, and watch for any adverse side effect. The fact that we're up to this level means that all the patients in these previous levels have been doing great. The company actually gonna do 1 more after this cohort because of the safety profile so far has been good. So for you to be included, if you're on riluzole or edaravone, you must be on it at a stable dose, so more than 30 days for the riluzole and 2 cycles for the edaravone. Your vital capacity must be greater than 65. And that's a bunch of other smaller, quite easier criteria, but those are the main ones. The third study that we're involved in is the edaravone biomarker study. So edaravone has been now in the market for a few years now, and this study want to know if that make any difference in terms of the various biomarkers that we have for ALS, and those markers are involved in oxidative stress, inflammation, and neurodegeneration. We will use a set of criteria and measurements to check for these correlation between these markers and the progression in ALS. The study is about 24 weeks, and you will go through 6 cycles of edaravone. And this is for a patient who are about to start on edaravone. So And so basically, you shouldn't have any edaravone beforehand, or if you were having it, that should be more than a month ago. The next study is the oral form of edaravone. As you know, the IV form require you to get 14 infusions, daily infusion in the first month, and then every month after that you get 10 infusions. So it would be a lot more convenient if you can use it in the oral form. And as you know, edaravone is a free radical scavenger, and it reduced the oxidative stress and slow progression in a previous study in Japan. So the idea here is if you can get an oral formulation that will help the ease of administration. Objective of the study is to see how effective it is and whether there's any long-term safety issues. The study lasts about 51 weeks. The main criteria is you have to be older than 18 and younger than 75. You must be able to function independently. Your vital capacity must be greater than 70%, and you should have symptoms starting no earlier than 3 years ago, and you must be able to take oral medications. We're also a center for the Healey ALS platform trial. I'm going to skip over this because Dr. Locatelli at Holy Cross will talk about this in detail later on. So, if you're in central Pennsylvania, we're our center. And the idea is to test multiple medication at the same time. And I will leave to Dr. Locatelli to give you the details. We have a couple studies coming up soon. Remember our complement cascade friend here? So the previous medication blocked this cascade at C5. We're going to have a study that will look at another drug that block it at C3. And basically, as you know, like I mentioned before, when this cascade occurs, it leads to cell death and also a lot of inflammation. So if we can modulate that or stop that, hopefully the downstream effect will be modulated and decreased. And so the objective is to measure efficacy and change in disease progression, muscle strength, and respiratory function over time. The study will be 116 weeks. Criteria are very similar to previous studies, except that the onset of symptom couldn't be earlier than 72 weeks. So that's roughly a year and some months. You have to be fairly high functioning. You cannot have a diaphragm pacing system or plan to put one in, and you're allowed to use riluzole and edaravone, but you must be on a stable dose. The other study that we're going to have coming up is oral edaravone. So the first study was the biomarker study. The second study is oral, but that is given according to the IV schedule, which is 10 days out of the month. This one actually escalate the dose to daily. So you get one dose every day instead of 10 days out of the month. Again, to develop the oral formulation and to test also whether this dose given on and off cycles, like the IV form or daily or placebo, show any difference. Again, safety and tolerability is part of every clinical trials that we do. There's an 8-week screening period, 48 weeks double-blind treatment period, and then a follow-up period after that. If you, in the off-on cycle study, you may qualify for this daily study. And again, the criteria are similar to the previous study. We also will start this other drug called Masutani. It's an orally administered tyrosine kinase inhibitor. And this molecule is involved in microglia and mast cells. And these cells are involved in the maintenance and function of the motor neuron. They're basically supporting cells. So there's evidence to suggest that dysfunction of these cells cause the neurons to die, and as a result, resulting in ALS. So if you can find a way to reduce neuroinflammation and degenerative microenvironment, that you will allow the neurons to survive longer. This is a phase 3. The phase 2 shows some positive signal. That's why we progressed to a later phase study. It's actually a very long study. It's 2 years. The criteria basically onset should be less than 2 years ago, and you must be progressed at a certain rate. The problem there is that people progress at a different rate, and if you're not progressing, it's really hard to test something that prevents progression. So if you're interested in our study, here are the here's the contact information. Jessica is our research manager. That's our number, and here's our email address. And if you need to get into our clinic, Kayla is our coordinator, and that's her number. And that's our team at the most recent ALS walk. Sorry here. I have a couple questions here. So these studies are, one of the questions is how many people are in the study. And the study, the second part of the presentation is the ongoing study that, well, all these studies are opening up for enrollment, and we're still accepting, patients who want to volunteer. Just call us and we'll tell you. Well, thank you so much for being here. I don't see any other questions. Certainly, if you have any questions, just reach out to us and we'll be more than happy to answer them for you. And I hope to see you soon.